Okay, welcome to the deep dive. Today, we're looking at something that, well, it feels like it's everywhere these days, menstruation.
Absolutely. There's so much more public talk, campaigns.
Yeah, policy changes even in some places. But our source today, an article from Global Public Health, asks this really sharp question. With all this noise, how is menstruation actually understood, defined within global health policy right now?
Right. And the authors, they took this, what's the problem represented to be, approach.
Yeah.
They looked at policy documents from big players, key UN bodies, the World Bank,
Huh?
and asked basically, how are these institutions framing menstruation as an issue they need to tackle? Because how you frame it changes everything, right? It shapes the solutions you go for.
Got it. So, our mission today is to dig into where menstruation pops up in these high-level policies and unpack what the source says is a surprising lack of, like, a single clear way of thinking about it. Let's get into it. Now, you might think with all the buzz, menstrual hygiene day, tampon tax debates, free products, that global health policy would be all over this with a clear plan.
You'd expect that, wouldn't you?
But here's the really interesting bit from the source. Despite all that visibility, attention at the global health policy level is still, well, they call it relatively muted and often patchy.
Yeah, it's kind of counterintuitive.
Yeah.
And their analysis shows there isn't just one way it's being addressed. There are these different, sometimes competing ideas floating around. But the dominant one, that's menstrual hygiene management, Emmy.
Ah, right. That makes sense. It came partly out of the wash sector, water, sanitation, hygiene. And
Exactly.
this push to close gender gaps, especially in schools, right? That ONESF definition from 2012 focusing on clean materials, privacy, disposal, that's MHM territory.
It is. And look, MHM was really important. It definitely helped get menstruation onto the agenda, no question.
Okay.
But the source points out there are critiques, big ones. Many argue MHM kind of reduces menstruation just to the bleeding part, the hygiene management.
Hmm.
It often misses things like, pain or the sociocultural stuff around it, the whole cycle, not just the period days. And it can exclude people like trans men or non-binary individuals who menstruate.
Hmm.
The critics basically say it risks framing menstruation as just this unhygienic problem we need to fix.
Okay, so MHM is the main frame, but it's got these limitations. Are there other ways policy is starting to talk about it?
Yeah, the article mentions others emerging,
Mhm.
things like menstrual health, which is broader, more holistic, thinking about overall well-being, kind of like the WHO definition of health itself.
Right.
Then there's menstrual rights, framing it as a human rights issue linked to dignity, education, participation. And even menstrual justice, which is more of an umbrella term looking at systemic oppression related to menstruation.
So different angles starting to appear. But the source argues the MHM focus creates silences, things that get left out.
Yeah, exactly. That's a key finding. Because MHM is so dominant, certain things just aren't getting much attention in policy, like a life course perspective,
Yep.
meaning the focus is so heavily on adolescent girls, especially in schools. You hardly see policy addressing menstruation. For older women, think menopause transition, or properly including the experiences of trans and non-binary people.
Right. Still stuck on the schoolgirl narrative.
Pretty much.
Yeah.
And they point out this focus on schools persists even when that old statistic, the 1 in 10 girls miss school one, is, well, its accuracy is debated, sometimes called a zombie statistic. And things like pain, which is a huge reason for missing school or work, often get overlooked in these hygiene-focused policies.
Okay, so the life course is one silence. What else?
Well, related to pain, there's very little policy attention on menstrual-related illnesses generally. Also, limited connection with sexual and reproductive health and rights, SRHR.
That seems like an obvious link.
You'd think. Contraception, broader reproductive health, it's all intertwined with the menstrual cycle, but policy often keeps them in separate boxes. And finally, surprisingly little focus on the environment. Disposable pads and tampons are often still presented as the solution in policy documents, without much discussion of waste or alternatives.
Wow. Okay. So policy is happening, but it sounds fragmented, quite narrow in focus, and missing some really crucial pieces.
That's the picture the source paints.
So what's the upshot of all this? What does this fragmentation mean?
Well, the source argues it makes things difficult. Without a clear shared understanding across global health actors, it's hard to advocate effectively. How do you push for comprehensive solutions across health, education, WSAH, if everyone's defining the problem slightly differently.
Right, it hinders joining things up.
Exactly. It makes cross-sectoral work harder. Though on a positive note, the source does mention there is growing awareness within these big organizations that menstruation is a multi-sectoral issue.
Yeah.
So maybe that's a sign things are starting to shift.
Okay, so wrapping this up. This deep dive really highlights that, yes, menstruation is finally on the global health agenda, which is huge.
Definitely.
But how it's actually being defined and understood in policy is still very much evolving. And there's this strong pull towards the hygiene aspect, especially for adolescent girls, which means these broader health, rights, and justice dimensions are often left behind.
That's a good summary. And the source really focused on how menstruation gets constructed, how it's framed as a policy problem. Which leaves a really important question, I think, for you, the listener. How does the way we define any problem, the specific language we use, the box we put it in shape, the kinds of solutions we even think are possible, especially for something as universal yet personal as menstruation?
Hmm. That's definitely something to chew on, how the frame dictates the picture.
Exactly. Something to keep in mind as you come across these kinds of global health discussions.
A great final thought. Thanks for joining us for this deep dive.